Hey, my name is Dr. Patel, and we're here today to talk about teeth whitening. So first and foremost, a lot of patients come in asking about whitening toothpaste. Does it actually work? What is it doing? So with whitening toothpaste, you get some whitening effects because it removes the stains that are sitting on top of our teeth, but we don't see much of the intrinsic stain getting removed. And so yes, you get a little bit of an effect and they are good to do as a starting process, but we want to focus on doing some kind of teeth whitening procedure. There are at-home kits that you can use. However, they do take certain amount of time, so there's kits that you would have to do constantly till you get to the shade you want. The other way to do it is having your local dental office do teeth whitening in office for you. What is the difference with the one we do here in office and the one you can do at home? Well, the main thing that I have noticed is the one here in office is a little bit stronger, and so we get a quicker and a faster result. Yes, you do still have to follow up on it. We might have to do 2 or 3 treatments before we get to the shade that you might be happy with, but it's quicker and we can get it in 2 or 3 appointments. The at-home ones, you might have to continue to do them every other week or every 2 weeks until you get to that stage. The other thing I want to talk about with whitening is sensitivity. Is it bad for your teeth? Teeth whitening, if you have cavities, can increase how quickly that spreads because the bleach is a sort of an acid, and so that eats up your teeth. One of the things I recommend is that we take care of cavities and fillings and things like that before we are talking about whitening here in office. That's one thing you want to make sure with your dentist, that you don't have any cavities or things like that, or it can increase the effects of the cavities that need to be taken care of. The sensitivity is because we have tubules in our teeth and those are getting cleaned out, and with the hot and cold, with bleaching or with whitening your teeth, pores of the tubules are a little bit more open, and that's what's causing the sensitivity. It's not necessarily that it's bad, but yes, the sensitivity does happen with teeth whitening, and so you want to make sure that if you come into the office to have the teeth whitening done, or if you're doing them at home on your own, you want to make sure that you keep in mind that there might be some post-operative sensitivity that can happen. It should go away on its own, but you want to make sure you're not bleaching or you're whitening your teeth too much to where that sensitivity lasts longer. Whitening toothpaste is good. It does get some of the stain that is on the outside of the teeth out. However, the issue that the whitening toothpaste face is that it doesn't really kind of hit the intrinsic stain of the teeth. We really need to bring on some kind of whitening agent that can be found at home kits or in office whitening procedures. And so that's really the way we're going to be able to get those white teeth that most people are looking for. And like I said, it does take multiple appointments even here at the in-office procedures, and so you can't always expect to have one procedure done and you get the celebrity smile right off the bat. So that was a little bit about teeth whitening. Make sure you like, subscribe, and hit the notification bell. That way I can keep bringing you some little dental tips and tricks and some more content.